How does your project utilize digital applications for mental health support? Explain the specific technologies and its potential benefits for users.
So hello everyone, I'm Habib Nasser, PhD in data science. I'm CEO at eHealth, French SME developing mainly digital solution. And we are partner in the EU project Smile. So briefly in Smile, we co-create and we develop useful digital services and tools to support and motivate young people assessing their mental health while focusing mainly on depression and anxiety risks. Also, we intend to assist clinicians to make faster diagnosis and accurate decision via an explainable decision support system. So mainly we develop two user-friendly applications. Firstly, the companion mobile app that allow them to collect higher quality of data collection and developed by the app, and thanks to the assistive chatbot provided by the University of Maribor. So this mobile app also provides extra digital feature to increase the discoverability, the engagement, the awareness about the benefits of positive mental health and the active aging well-being of young people. And a second user application is a CBT-driven application, gamification app, and it allows adolescents to learn new skills, new coping skills, practices and competencies to increase their cognitive flexibility and resilience against depression and anxiety risk. So through personalized gamified scenarios and digital intervention, for example, from starting by storytelling, focusing on positive thoughts, and resolving problems in stressful and specific conditions, we try to increase their resilience against mental health risks. So at this stage, we are developing a first prototyping by integrate all these modules together in order to be tested and provide useful services and tools for both young people and clinicians. So that's all. I'm happy to be in this webinar and can provide more details about our tools later if needed. Thank you.
Addressing data privacy concerns. Recent studies reveal growing user skepticism towards digital applications, particularly regarding data privacy. How does your project address data privacy and security for users interacting with your digital tools?
Thank you. So as in the other projects on Smile, we collect various user data, such as personal information, evidence-based question and response, daily emotion, and also diary recording to assess mood and mood sensitivity. So safeguard is a crucial concern in our project, and that is addressed early by design in our prototype. Our tools are strictly comply with the GDPR guidelines and ethical aspects. And as I said, as other projects, so during the requirement phase, we'll collect consent of all users. We will inform them about their information rights. So in a comprehensive way, we'll tell them clearly how data will be used, how will be processed, where it will be stored, for example, and when it will be erased and used. So maybe from the technical point of view, personal data in our project are secured and managed via Keycloak server, in order to unify the user management, but also protected by combining various security techniques such as JAT, encryption, and the identification. For the patient-related information is well structured and stored in a dedicated file server provided by University of Maribor in order to ensure privacy and protection, data protection. Moreover, we have a specific tool provided by Africa, our coordinator, called SAPL, that is used to enable dynamic authorization and based on user roles and access policies, ensuring secure access through the entire workflow in a dynamic way. And maybe at the end I can say the two user application, the companion mobile app and the gamification app. In this application, users, maybe young people and user, are anonymized and they're represented by avatar in order to protect their identity in the digital world and increase their participation in our ecosystem.
Sustaining user motivation and adherence. Ensuring sustained user engagement is a significant challenge in digital mental health interventions. How does your project design applications that not only motivate initial use but also support long-term adherence, while aligning with both technical requirements and medical protocols?
Yes, thank you. Just I want to briefly to share our approach to ensure the long-term engagement in Smile. So in the simple way, we are enhancing the user experience by making the user application user-friendly, easy to use, and intuitive. So more the future are comprehensive, more clinician and people are engaged and aware about the benefits of it. And also we are motivating them by rewarding their participation, sharing their data, and based on their achievement. So young people will be rewarded and their level will be higher based on, for example, the self-reflection provision, the accuracy and consistency on responding to the questionnaire. So the system is not, the rewarding and leveling system is not yet tested, but as said, Rudiger will pay attention that are not using our tools only for the smiles, for competition to win, yes, these rewards.
Human in the loop approach. While digital tools offer valuable possibilities for mental health support, the role of human healthcare professionals remains crucial. How does your project integrate human expertise and oversight alongside digital interventions and ensure that human practitioners are involved when necessary?
Yes, thank you. So firstly, we can say that all our solutions, Smile and services are co-created through living labs in a collaborative way. And also we believe that humanizing tools will not only increase the confidence in treatment or digital intervention, but also will ensure greater trust and retention on our digital tools. So in Smile, our goal is not to substitute clinicians, but provide them tools and assistive tools in order to ensure faster assessment, accurate follow-up, for example, after a treatment. That's why we are putting clinician at the core of our digital intervention and decision process. So the final decision will be mainly made by the clinician, as we can trust 100% the machine. So also we offer various services to help professionals to visualize results during the whole phases and workflow of the project or the process of treatment of the mental health cases. And we enable them to make informed and accurate decisions. Just in Smile, we have, for example, our questionnaire or evidence-based questionnaire are triggered automatically. But now we are authorizing, for example, clinician to trigger a specific questionnaire for a personalized remote decision or demand monitor. So the objective is to involve the clinicians or professionals in the whole workflow from pre-assessment till the treatment. Also, in order to humanize the ecosystem of the process in Smile, we are giving young people, for example, the possibility to provide their own observation via, for example, in the mobile app, they have, for example, reflective exercises, and the game they have, for example, gamified storytelling to not only consider objective measurement but also subjective observation. And in our recommender system, we are trying to integrate empathy while providing digital assistance and recommendation to increase the involvement and the role of the human in the whole process.
Q&A session. Live on camera question. How can we adopt a two-directional approach to mental health, where we not only support individuals in diagnosing and treating mental health conditions but also focus on cultivating mental well-being and resilience in daily life? How can professionals help people, especially young individuals, manage everyday pressures and prevent the escalation of anxiety or depression without always resorting to a clinical diagnosis?
It's just maybe a comment. So in the gamification app, only young people are users. So and maybe in the awareness mobile app, We are providing a specific feature, is called peer support, where, for example, that we are enabling experienced pupil and adults, maybe parents or teacher, that can share their experience and learn skills, competencies, for example, to focus on positive thoughts, how to be more flexible facing stress, via typical, we can say, thematical discussion, where they can bring young people together and try to share their experience with them. But we are imposing in this peer support, we can say, rooms, the presence of qualified moderator and professional in order to avoid any concerns and issues during the discussion and sharing their experience. So maybe that can be, yes, a way to share skills and experience.